the peritoneal dialysis setup, you're going to need your solution bags, your cassette, and your drain bag ready to go. Then you're just going to go to your cycler and follow the prompts on the screen.
Gather your treatment solutions according to your program.
So the machine is very user-friendly. It tells you what to do.
Open front door and heater lid.
So after you do a task, you're going to press next to tell the machine to continue to the next phase.
Package with the guide, making sure the cord is not twisted.
I have only one hand to work with.
Understood.
Do not clamp the patient line.
So we're just clamping off on the solution lines, and prior to doing all of this, the patient is masked and they've washed their hands.
Insert the line organizer in the clip on the right side of the device.
And also, their animal's not around, and they're in an enclosed environment. The AC and the fan is in the off position while they're setting up the machine.
Insert cassette in front door and secure left and right lines.
So we're inserting the cassette into the front door, making sure that it's correctly placed in the guidelines. Empty bag into the heater, and then we're going to close the door and close the front door.
Patient line holder.
So this patient line with the green pull ring is placed on this side. So the machine does like a self-test,
Place patient line.
making sure that everything is correct.
Organizer and place it in patient line holder. Close the white clamp on the drain line sample point.
To connect the drain bag to the drain line. And this is where all of the waste will collect during the nighttime therapy. As long as the patient doesn't touch any tips, sterile tips, so any connection that has a cap on it, you don't want to touch the tip
Right.
of your connections. So you want to make sure that you have a mask so that way you're not breathing on those sterile tips. So we'd have our bags on the IV pole, or they could have it on their bedside table, whatever's convenient. So if a patient did have to use the restroom, then they have about 20 feet of line to walk to the toilet. If not, then they can easily disconnect from the machine and go to the restroom and come back and reconnect to it safely.
So those 2 bags are everything that's needed for one night in terms of fluid?
It's going to be individualized, so other patients might require more bags.
Okay.
With the machine, you can actually attach a total of 4 bags. There's sugar, calcium, magnesium. It's like saline fluid with calcium and magnesium and sugar. We have 4 different types of solutions: yellow, green, red, and purple. So basically, the yellow is a 1.5% solution. Green is 2.5%. And this is the concentration of the sugar in the bag. So the red pull ring is a 4.25, which is the strongest solution strength. And then our purple is a special solution, and it's called extra Neal, that one has no sugar in it. So, you know, for your diabetic patients, they might do better with that to control their blood sugar levels. But that one is actually a special type of solution that helps to draw out toxins and solution at a slower rate than a 4.25% solution. Cassette test is complete, and we're going to go to the next phase. So the cycler is reminding us to mask and wash our hands. And then we're going to connect our solution bags to the lines. And so the machine tells you which lines. So the lines are actually color coded as well. You see red, white, and blue. Okay. So with this type of therapy, it's telling us to connect the 2 white lines to the solution bag. So we're going to do that. So we teach patients how to make safe connections, and they have to make sure that they make the connection the same way all the time. I'm gonna pull off the white clear tab, and then we're gonna pull off the green tab, and then make a connection. And I can't do this with one hand. So again, you're making sure that the tips don't get contaminated, you know, by touch, by you breathing on it, you know, touching any thing around it. So and then you would have to break the frangible right here. So again, good hand dexterity is very important. So I'm going to connect my second bag. After you've connected your solution bags, then we're going to the next phase. Again. So there's like a second check to make sure that you've connected the bags to the appropriate lines. And then it's going to go into the priming phase, which is going to get all the air out of the lines. The air is going to go towards the drain bag. And then after this, it's going to be ready to start the therapy. So the machine can be set up anytime during the day. It doesn't, I mean, most patients will set up their machine prior to bedtime, but, you know, if a patient wants to set up their machine earlier, they can.
That's convenient.
So the priming takes about 20 minutes. And the next step after this is connecting the patient to the machine, and that will start their therapy. So like after the priming phase, they would leave it at this phase and just leave it like this until they're ready to do their dialysis. Well, with this machine, it takes 20 minutes to prime the cassette, and then also it'll fill up the heater bag on the top, that empty bag that we had on the top. It has to fill that bag with solution. It also has to warm up the solution. And then it also will prime the drain line. Need like technical assistance? There's also a 1-800 number technical assistance line that they can call 24 hours on the mainland.
And that's for the machine itself?
Yes, and if they have clinical issues not related to the machine, then they would call the on-call nurse.
Okay.
Basically, that's it with this machine.
Thanks for showing that to us.
Thank you.
What does it cost to treat a dialysis patient, and how much of that cost does the patient have to cover? So
it's about 114 billion a year spent on treating a dialysis patient in the U.S. And, you know, by doing all of these initiatives to prevent kidney failure and focus on early prevention and educating the public and the community about chronic kidney disease, it'll save us about $4.2 billion a year. So with dialysis patients, as they enter end-stage renal disease, if they have to have some type of insurance to cover the costs of dialysis. Once they start dialysis, then the social worker will work with the patient to get a secondary type of coverage to cover their dialysis. But basically, if a patient chooses to do in-center hemodialysis, then there's a small copay with that. And if a patient should choose home dialysis, the incentive, there's not much coverage. I'm sorry, cost to that. As long as they have a secondary insurance to cover that cost. But all of the supplies are covered. It's covered under their insurance.
In-center hemodialysis is the most expensive type of dialysis. Is that correct?
Yes.
So that makes me guess that that's part of the reason behind the executive order and the desire to save costs is to decrease use of the clinics.
Well, with home therapy patients, they have less hospitalizations. Most of the in-center dialysis patients, they have more frequent hospitalizations because of either infection or their access complications that occurs. So with home therapy patients, the actual hospitalization rate is actually lower.
Oh, wow.
Yeah.
Okay.
Yeah.
That's nice to know.
Yeah, it is. For patients, to make sure that you see your primary care doctor or primary care physician on a regular basis to make sure that all of your lab results are fine, because that's probably going to be the way that you find out about your chronic kidney disease. A lot of patients don't know that they are in kidney failure until the time comes when they end up in the emergency room. So again, listening to your body and your symptoms, and just seeking that medical guidance from your primary care physician, increasing your knowledge about your dialysis treatment options to make that informed decision to start dialysis. You want to make those decisions early on so that you're prepared, and also to accept the diagnosis of kidney failure. For some patients, it's kind of like, not a,
It's
they
traumatic.
don't, yeah, it is traumatic, and they need to be able to cope with it, adjust, and make adjustments to their lifestyle once they find out. So, most patients, they find out that they have kidney disease maybe 5 to 10 years out. So they're aware of the situation, and they can slow down the process or the progression of kidney failure if they, do as they're told from their physician to change their lifestyle, change their diet, and make sure that they take the necessary medications to decrease that progression into kidney failure.
Great, thank you.
Thank you.
I'd like to finish just by expressing our gratitude to you for sharing all of this great information. We know it'll be helpful to people.
Okay.